Hi, I am Dr. A. Santhosh Kumar, practicing as consultant urologist and andrologist at Lux Hospital, Gachibowli, Hyderabad. So, premature ejaculation is the most common condition usually we see in 30 to 40% of the young population. So, the definition varies from each and every person. So, initially, what is premature ejaculation is nothing but without preparing himself, the person ejaculates before his consent itself. So this is most commonly seen in people usually who are anxious, in the young married couple, and who are stressed. These are the conditions usually which can predispose to premature ejaculation. So whenever a patient presents that he has premature ejaculation, we have to take history, proper history. It is a condition where both partners should be happy after having intercourse. If they are not happy and if he has premature ejaculation, irrespective of the time, then we diagnose it to be premature ejaculation, and there are various treatment options. Initially, it's only most commonly it can be because of stress induced or psychological. So we usually counsel the patient and we'll give him sex education regarding what is the cause of this premature ejaculation. After that, if the patient is not responding, we advise him few medication for the premature ejaculation to be stopped. Sometimes patients we usually advise him to do few techniques which can help himself to reduce his premature ejaculation, like using condoms or barriers during intercourse, or at the same time they can use some gels or sensitive which can decrease the sensitivity of the glands during intercourse, or sometimes usually we ask him to squeeze the penis whenever he is about to ejaculate, then relax himself and he can participate second time. So these are the various techniques which can help him naturally to reduce his premature ejaculation.